minutes is the duration of stage 2 labor of the mare. By coincidence, Toth is a good friend now, and he's in Hungary in practice and boarded in medicine. We needed a project for him, for his master's. And so Dr. Allman and everybody got together and says, I've always wondered what's going on in the brain when you squeeze a foal like this. We got all the tools to do this. So let's do it. So we had this thing, we're going to look at the HPA axis, the venous blood gas, pain threshold, brainwave, metabolic stuff. And since we were doing the project in maladjusted foals, why not throw in all those mass spec assays? So some reviewer will say there's some really good science here rather than a guy tying a rope around a foal and watching him go to sleep. Solomon said, I got to have a good smooth brainwave. So you got to hold that thing for 20 minutes. Well, we tried that. And we got somebody besides me, the guy go to the gym and everything. You couldn't hold that thing steady. So what we came up with, I remembered I used this thing. This is from the Cornell restraint book in the 50s. Well known that adult cattle, you put this half-hitch system on them and they'll lay down. And so I thought, well, maybe we could try that in the foals. Toth, he's not particularly enamored you could tell by his expression. His whole dang master's thesis depends on this thing working. Toth watching, holding the foal, hoping to hell this thing works. And there he is laying down. And when people talk about how much pressure you have, you can see roughly idea here. I've just got enough I pulled on him enough that he laid down, then I'm keeping that same amount of pressure. If he starts to wiggle, I keep it a little tighter. Toth is looking at his watch, probably saying a small prayer in Hungary, or what in a language I don't understand, hoping to hell this thing works, because we got to get 20 minutes of recording. So there we have it there, and then we let the rope off and want to make sure the foal's okay. They lay there for 20 minutes, and then as soon as you let them up, they stand up and bang, they go over and back with the mare. So we did the study, and here's the results. We published American Journal of Vet Research. It produced predictable, and we use the term somnolence because they went into non-REM sleep. Observed on the brainwave. So their brain was affected by this squeezing. Heart rate and respiratory rate go down, endorphins go up. We put this little thing that gave us a little sensation. The pain was a little bit less, but they're not unconscious. And if you poke them enough, they'll wake up out of this. And no change in venous blood gas, no long-term adverse effects, really quick. So we showed that this was safe. And so I'm wondering, it's 20 minutes, after 20 minutes, these two hormones went up. And guess what? 20 minutes is the duration of stage 2 labor of the mare by coincidence. So could it be that the reason they become immobilized is they're going through the birth canal? And if you're lucky enough to get a nose and 2 feet, it's a miracle that it happened so well. Of course, we know not all the time. But why not prevent the foal from wiggling while you're going through the birth canal, turning the head around and all that stuff, using the squeeze-induced somnolence or tonic immobility, and then start dialing down the anesthesia of 11 months of keeping you asleep in the womb, because you got to get up, you got to fall in love with your mother, you got to run around, you got to have a whole bunch of things happen. So wouldn't that be the coolest system ever developed?